You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time. Today on the podcast, we have Nicole, and Nicole is a certified holistic nutritionist. She helps others restore their health by healing their gut and strengthening their immune system. Nicole has a background in psychology and providing case management for chronically ill patients. Whenever she drastically improved her own health with nutrition and lifestyle habits, she felt compelled to help others do the same, especially considering what she saw every day at work. Nicole, I'm so excited to have you here on the podcast today.
Thank you. I'm excited to be here.
Yeah, I would love for you to share your story. Tell our listeners how you got into what you do and how you went from case management to being a certified holistic nutritionist.
So when I was about probably 7 years old, I started getting sick constantly. Like I'm talking every 6 to 8 weeks, I would get sick with a cold. That would turn into asthma. I was always on antibiotics, steroids, breathing treatments, all of that until I was about 22. At the same time, I lost all of my grandparents very young. I didn't realize it at the time, but now being 31 and looking back, I'm like, wow, they were very young people. They could have still been here today. And it was all due to chronic conditions, complications from diabetes, autoimmune conditions, cancers, stuff like that. And then my own parents and very close relatives have dealt with chronic illnesses too. My dad's side is a lot of diabetes, hypertension, and stuff like that. My mom's side is a lot of autoimmune. So I grew up seeing that. And again, I was always sick. It was a joke, really, like among my friends, like, oh, Nicole's sick again. But at 22, I decided to change my diet because I'd started dating my now husband and I had really bad stomach issues and it was embarrassing. That was the only reason. I was just like, I can't use the bathroom in front of you. And like, it was embarrassing, you know? So I cut out gluten and dairy and I just said, I'm going to incorporate fruits and vegetables, just a little bit. And not only did my digestion get better, but I noticed like 4 months in, I'm like, I haven't gotten sick. And then 7 months in, I haven't gotten sick. And I actually didn't get sick again until I started to reintroduce gluten and dairy.
Let me ask you, what did your diet look like beforehand? Did you think that it looked healthy?
I thought, I thought it did. You know, growing up, my mom cooked dinner every single night. I was with my dad on the weekends. He cooked where we went out to eat, but we were going out to like nice places. It's not like it was constantly fast food or anything, but just a lot of gluten. We know wheat is in everything, right? So chicken cutlets or sauces or a sandwich, stuff like that. I loved cheese. I probably ate cheese every day, mac and cheese like 5 times a week. And I didn't think anything of it. You know, I thought it's normal. No one ever questioned it. So there was a lot of gluten, a lot of dairy. It looked like balanced, healthy meals, but knowing what I know now, it was causing a lot of inflammation in me at the time.
Right, right. Yeah, I think that a lot of people don't know how to look at food, the food that
Mhm.
they eat, and see, okay, is this really healthy long term? A lot of people don't think about how much gluten or dairy or hidden ingredients are in
Mhm.
things. Really taking a deeper look into the hidden ingredients in things is
Yeah.
so important.
Yes. And unfortunately, I think when we were growing up, people didn't even really know what gluten was,
Yeah.
So how is anybody going to really connect that? And people think eating high amounts of dairy is healthy, and when they cut it out, they feel so much better. So yeah, there was no red flags in my diet. Doctors never asked about diet.
Yeah, wow. Which now, depending on what kind of provider you go to, that's one of the biggest things is
Mhm.
you're supposed to ask about diet and lifestyle
Mhm.
first. However, that isn't always the case, but
Right.
lifestyle interventions are always pushed so much more. They're supposed to
Mhm.
be. So you didn't get sick for a few months after you chose to change your diet.
Yeah, so I changed my diet January 1st. I probably started reintroducing things in the summer, and it was probably sometime that summer that I got sick for the first time. Although I didn't need the inhaler and all of that. And I think that that had a lot to do with the fact that I wasn't constantly overloading my system with the dairy. So I didn't have all of that inflammation just lingering in my lungs.
And when you got sick, your symptoms were so much more upper respiratory type
Always,
sinus and asthma type issues.
always, yes.
Okay. Yeah. So that's interesting. You know, whenever I would have certain foods in the past and cut them out and then reintroduced them, my issues was so much more related to my stomach pain and gut pain and irregular bowel habits.
Mhm.
But it's interesting that even the respiratory system reacts to the food that you eat.
Absolutely. Even now, if I binge on sugar, my sinuses will flare up. And I've told this to my doctors, I've told it to people in passing, and they look at me like I'm crazy. But maybe that's just a weak spot in my body. But yeah, I eat sugar and immediately I'm congested and it just feels like sinus pressure.
Yeah, that is so interesting. So what did your journey look like after that? After you reintroduced it and realized this is what's making me sick?
Right. Probably over the course of a few years, I was taking things out, reintroducing them, kind of trying to find the balance between eating things that I wanted to eat, particularly if I went out to a restaurant, and managing my symptoms. Eventually, I kind of went down the meatless route. I started eating way too much gluten, and that's when I had a lot of the stomach problems. I had daily IBS symptoms for about 6 months straight, breakouts, all of that. I wasn't eating the dairy, but I was eating the gluten. And that was when I realized that gluten was a bigger problem than I'd realized. And so I cut it out and I didn't get sick for about 3 years. It was over the course of that time where I started just really removing the processed foods and bringing in more real food. And it was also around the time that I got my holistic nutritionist certification. And this is all overlapping with my career on top of it, right? So I'm also working as a case manager now. I'm seeing people, I'm seeing their chronic conditions. I'm seeing new people come onto the program and I'm seeing them slowly decline in their health. In general, I went through a few years where reintroduced things, realized what was really bothering me and the extent to which I was getting sick, and then just cut it out completely and stopped getting sick.
Yeah. So how did your life change besides not getting sick anymore? How did that impact your day-to-day life?
No anxiety. I think we all kind of struggle with anxiety. I was getting it really bad. When I tell you I cut out gluten, and within about 3 days, the tension and the anxiety that I felt every day just melted away. I slept better. I wasn't nervous about leaving the house because I'm not afraid that my stomach is going to act up. And it's also just really freeing to be able to go out during cold and flu season and not worry that every little germ is going to impact you. I also felt more confident. I felt more confident in vocalizing, I'm not eating this. This is why. I know this is what it does to me. And that's that. I'm just not going to do it. I don't care if we're out at a restaurant, I'm just not going to do that to myself because I
Yeah.
know what it does.
Yeah. And that's awesome. That's just really rewarding to feel more confident about your
Absolutely.
decisions and who you are just
Yes.
after going through something like that.
Yeah.
Okay, Nicole. So I know you've mentioned something about terrain theory.
Yes.
What is that? Because I have no idea.
So I didn't know for a long time either. I think I stumbled upon it by accident, but it really resonated with me because, like I said, I cut out these foods and then I just stopped getting sick. And I was always around sick people. I was case manager going into hospitals, nursing homes during flu outbreaks. So there's germ theory and terrain theory. Germ theory says that the reason we get sick is because there are germs, little microorganisms that we either inhale or we ingest in some way, and they cause an immune system response from our bodies, right? Terrain theory says that if you get sick, it's not because of a germ, but it's because there's already an imbalance in your body. And that can be caused by something food, environmental factors, stuff that you're putting on your skin, anything like that. And so I started doing a little more research. I don't know if you're familiar with Dr. Zach Bush.
Yes.
Yes, I love him. And he talks about how viruses are actually meant to communicate with our DNA. Essentially, they tell our DNA how it has to adapt to its environment. And so viruses are meant to be passed from person to person or from species to species. And if a virus is making you sick, that's because your body doesn't know how to make those genetic updates. And so that kind of goes along with terrain theory. And that explains why people who are taking care of their bodies, who don't have a lot of inflammation, they can come in contact with the same virus as another person and they don't get sick, but the other person does. When I first heard about terrain theory, I honestly thought it was so empowering because it really puts the power back on the person to make the decisions and potentially make getting sick optional.
Yeah. Wow. I think the concept of that I've heard before, but I've never
Mhm.
put like a title to it.
Right.
But that is very powerful. That's so interesting. It makes complete sense to me though, once you think about it.
Yeah.
Since I healed my gut, I have noticed that I have not gotten sick as often. I think I've had like one sinus infection maybe, and
And
that's
you have
whenever.
young children, right?
Yes, I have 3.
Yeah.
3. I have 3 kiddos,
Yeah.
and they're very healthy as well, but I guess I always attributed it just to me being healthier, eating healthier,
Mhm.
incorporating all the different foods,
Mhm.
but also taking into consideration what you said about terrain theory, that just makes so much sense.
Mhm.
That's awesome.
Yeah, the way I like to describe it to people is if you're eating healthy, it's not like your body is suddenly producing all of these antibodies to different germs, right? So your body must just know how to work with the virus and make those updates. I know I have days where I feel a little bit run down, where I might just need a little bit more sleep. And maybe that is my body kind of adjusting to this new virus that it's just come in contact with. But as far as being bedridden and sick, that doesn't happen. And as someone who grew up constantly sick, that's so freeing for me.
Yeah. Yeah. Oh my goodness. I'm sure. And just seeing like how this runs in your family, this
Mhm.
always being sick. I know I can relate to that as well with family always having gut issues. And I just think that that's such an important message that I hope people gain from this is
Yeah,
that you are not your family history. You are
right.
not your genetics. Like you can change things and just really listening to your body. Like you said, feeling kind of run down, maybe you just need to sleep some more. Maybe you're not really going to be getting sick. However, if you push through and ignored your body signals, you might. And
Yes.
I think that all of that too, just in the back of my head, I'm thinking how a certain virus affected so many people so differently, over the past few years and still does. Some people have a tragic ending, and some people it does not even phase them and they don't know that they carry it. And that's just an example. Wow. I just have to let that soak in for a minute. That's really
Yeah.
interesting. So, Nicole, can you tell me what are some warning signs that our mucus is sending us?
So mucus is an immune system response, right? So if you are someone who is chronically congested, you sneeze a lot, you wake up very mucusy, that's a sign that your immune system is working overtime. If it happens once in a while, you come in contact with an allergen or you are sick, that's fine. That's an acute response. That's your body working. But if you are experiencing mucus day in and day out, that means your immune system is chronically overworked. And when your immune system is working, your body is experiencing inflammation somewhere. It could be in a localized area, it could be everywhere. That inflammation, that chronic underlying inflammation, leads to disease. So if you're experiencing chronic mucus, you want to get to the root cause. I wholeheartedly believe that it starts with the gut, but you want
Yes.
to get to the root cause and you want to fix that because it's essentially your body's warning sign that disease is on the way. It's progressing.
That just puts other things into perspective for me as well. I've had a lot of education in health and wellness and nutrition, and haven't thought a lot about the connection though that our mucus has. And a lot of people don't want to think about mucus. It's not pretty, right? But just thinking about it as a signal that your body is giving you as well,
Yeah.
and to listen to your body and, what is it telling me? That's just every little thing, whether it's, gross or normal or common or something that you think everybody's always had in your family. It's
Mhm.
important to pay attention to it and question it. Is this optimal? What is my body telling me if this is going on? So
Absolutely.
I like that hidden little trick there. That's pretty
I think
cool.
sometimes you have to talk about the gross stuff too. Like I'm the friend that my friends will text and be like, hey, my poop looked like this. What does this mean? But it's all of these little things, all of these gross things. That's how our body communicates with us.
Yeah.
And it's important to stay on top of it because nobody's going to do it for you, you know?
Right. I know, especially with 3 kids,
Yeah.
if they do say that their tummy hurts or something, the first thing I say is, "Okay, well, when did you poop last and what did it look like?" And I don't know if anybody else does that, but to me, that's the first thing I'm gonna say, and they're like, "Oh, mom," and I'm like, "This is completely normal, first of all. Everybody does it, and this
Right.
is a big warning sign. We need to
Mhm.
see what it looks like and what it's telling us." So,
Mhm.
I could not agree more.
Yes.
So there is such a connection between the gut
Mhm.
immunity and inflammation. It's just all connected. I've always said that, but you've just really reinforced it for me today. I love it. So the warning signs that these viruses are sending us, it's really kind of, what would you say that is, that they're telling us to listen to our body more, to be able to adapt to our environment?
So I would say if you are, this is what I tell my parents, this is what I tell everybody when they get sick. If you are catching frequent colds, that's your first signal that there's a breakdown somewhere in your body, right? Your body is not in balance. So let's first take a look at your diet. What are you putting into your body? And it can be anything from the gluten, the dairy, the sugar. It can be non organic food, all of the pesticides that are sprayed on our food really wreak havoc on our system because it's poison and your immune system then has to fight that off. So I would say look at your diet. If your diet is optimal, look at what you're putting on your body, look at what you're putting on your skin. What are you bathing in? There's so many toxic chemicals that our skin just absorbs. What kind of candles are you lighting? Everything. Take a look at your diet, your personal care, and your environment. Somewhere there is a breakdown and it's causing your body to respond poorly to these viruses. And that is a sign that there's already some sort of ongoing inflammation and dis-ease going on in the body. When you
Yeah.
stop getting sick, that's how you know that you're in balance.
Yeah. I love that analogy. I love the comparison. And I think it also is really neat to look at a virus as not necessarily a bad thing. It's a neutral thing, and
Mhm.
it's how our body handles it and what we do with it that really matters. Let me ask you this though. So, whenever you really started to change your diet and work on your health more, that's whenever you first started dating your now husband.
Yes.
As what would he say? What is his opinion of all of this? How has he seen you change? Has he
I
pointed
mean,
anything out?
just the stomach issues alone are night and day. he makes jokes about how fast I am in the bathroom now because I'm in and out because everything's working. He's really followed along with it. Like he has been on this journey with me. He isn't quite as strict, but he has made changes too. But definitely what he has seen of me specifically with my stomach issues, because that caused so much anxiety, like in going out. I mean, he would say it's night and day. He also now frequently talks to me about his bowel movements and how he's feeling. He loves to do it over dinner.
Perfect.
But he's really embraced it. And, he really tries his best to listen to his body more, manage his symptoms, and things that in the past he would eat without thinking twice. Now he's like, yeah, probably shouldn't. So he's been on the journey with me and he's embracing it. Thank God.
So, for any of your family that is still alive that has seen you on this journey, have they asked you questions or asked you, like, what are you doing, and kind of seen this?
I think when I first started, it was just a little bit bizarre to them. People are like, what is gluten? What are you talking about? Like, why? I don't understand. It was weird. But as time has gone on and I lost weight just in a very healthy way, just extra inflammation that was on my body, I lost that. I don't have skin issues. I don't have the asthma anymore. I don't have the stomach issues. So over the years, they have asked me just little questions about their own ailments, but I think it takes time for people to wrap their minds around it. I can tell you before I started this journey, it didn't make sense to me that eating a vegetable would make me healthier. So I completely understand when people are just confused and they're like, you're nuts. But they've definitely seen the changes and they have certainly asked for my input and opinions. My dad actually, he has type 2 diabetes and he has really taken my advice in the last few years and has seen drastic health improvements as a result.
That's awesome. I just want to emphasize here that you seeing a bunch of your family live with chronic diseases and pass away from chronic diseases, it took that for you to kind of take a step back and just say, hey, wow, like my whole life I've been dealing with these things. And you were only in your 20s, and then seeing what your family had been living like and realizing that you didn't want that for yourself. You actually started seeing a difference just within a few short months. It
Yeah,
wasn't, it wasn't years later. And I think so many people want that quick fix. And if you take a step back and look at it in the long run, like that is pretty quick
that
because
is quick. Yeah.
some of these things, most inflammation does not happen overnight. It happens over years. And so people cannot expect to just reverse all of that within a day because it didn't
Right.
happen within a day. And if you really just kind of take little steps into changing your diet, just your diet, that's all we're talking about here, right? But you noticed a difference alone with your diet.
Yes. And I
And
was still eating processed food at that time because
yeah,
anything that I would normally eat, I just swapped it out for the gluten-free or dairy-free version. So it's not
yeah,
like I was eating this super clean diet. I had to
yeah.
start where I was and just make little swaps.
I think that's important to point out because everybody's busy. So many people have kids and work full time, or have a husband work full time, or work two jobs full time. And sometimes processed food is all that you can do. And it's like there are healthier options if that is all you can do. You can always find a healthier option. Even if you can't spend money to get all organic fruits and vegetables or don't have access to that, there are other options that you can choose to be healthier and see progress from and see change from. What are some ways that you think are best to take our health into our own hands?
I mean, diet, right? That's first and foremost is just be mindful of what you're eating and just meet yourself where you're at and make the little swaps. You don't have to do everything overnight. Like you said, you don't have to go organic and you don't have to buy all the nut flours and all of just make little swaps, meet yourself where you're at. I also think finding a provider who is in line with what your values are. So if you want to take your health into your own hands and really heal yourself holistically, finding a provider who is supportive of that and isn't necessarily going to push medication or is open to guiding you towards coming off of medication. I think that's a really great route to go as well.
Yeah, I couldn't agree more. That's awesome. Nicole, I know that you work as a case manager and have done that for a while, and now you're a certified holistic nutritionist. What do you do with your clients now exactly?
So I actually left case management when my daughter was born. So since then, I've really just been focusing on the nutrition aspect. So I'm actually in the process of working on a self-paced program to help others identify their food triggers, heal their guts, reintroduce what their bodies can handle, and teaching them what their diet should look like day to day, and how to find that balance between enjoying life and eating all the fun stuff while maintaining their health and supporting their immunity. So that's going to be coming out soon. In the meantime, I'm very active on Instagram, just promoting gut health and anti-inflammatory lifestyle.
Yes, I'm right there with you. I think it's just important to get the word out there and just educate other mamas and other people that are struggling with these things, that think that this is just how life goes, and
Yeah.
it does not have to be that way. I love everything that you're doing, Nicole. It's awesome. I'm glad that there's somebody else in this space that's trying to promote a holistic way of living,
Yeah.
and it's beautiful. We could talk about it all day long,
I
but
know it's so important to spread the word. I don't shut up about it. So
I think I'm right there with you. I really do. Well, this has been so awesome. Thank you so much for being here today, Nicole.
for having me. I love this.
Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative.